Wonderful. Well, good afternoon, everyone. It is nice to see your names. It was nice to see your faces. For those of you who don't know me, my name is Callie Peterson. Hi, Sheila. I am a program officer with the SCAN Foundation and have been working with and supporting our regional coalition network since we began partnering with you in 2010. So it has been a long-standing adventure, and as I said, a partnership that the SCAN Foundation is very proud of. If you are participating on today's webinar, which is not a public meeting, it is because you are a member of a regional coalition. We currently fund 20 regional coalitions that cover 95% of the state's population. And our regional coalitions partner with the California Collaborative for Long-Term Services and Supports. And that is a group that is based in Sacramento and primarily includes members whose organizations cover the entire state. Although our regional coalition partners are also now full-blown members. It's a really exciting network, and we're thrilled with the progress and work that they have been conducting, that you have been conducting together. The purpose of today's webinar is truly to get a deep dive and a greater understanding of a really impressive and important product, the Master Plan for Aging here in California. It's something that the SCAN Foundation has been very supportive of, and we are ecstatic that it is out and there is much great work to be done. So today we will be learning a little bit more about what is in the local playbook, which is a unexpected but really exciting component of the Master Plan for Aging that really gets to how do we start implementing this wonderful plan at the local level. So we'll learn a little bit more about that. We'll have a couple breakout sessions to kind of dive deeper into specific topics. We'll have a wonderful panel at the end of this event talking about some critical issues, housing, transportation, and bringing together both the aging and disability communities in support of long-term services and supports. And all of this is a really important presentation that we hope you learn from and pull from as you start thinking about a local Master Plan for Aging event that all of our regional coalitions are planning in 2021. So if you are a regional coalition lead and managing your grant, you're probably very familiar with that activity. If you're not quite as familiar, I do encourage you to touch base with your lead, the person that primarily engages with the SCAN Foundation and your grant. But we are very excited to have 20 local events, again, to spread the word about what's in the Master Plan for Aging and start thinking about those critical next steps. So with that, I think let's get to the exciting part about this meeting, and we are incredibly privileged to have a welcome from Kim McCoy-Wade, the director of the California Department of Aging. So with that, Kim, welcome, and thank you so much for joining us today.
Thank you. Thank you. Good afternoon to all of you. It's great to see all the names on the side. I am just so happy to be with you and happy to tell you that this morning I was giving Governor's Office an update on what was happening with the Master Plan for Aging implementation. And I said today, this afternoon, a couple hours, we are rolling out our first local playbook partnership with who other than the SCAN Foundation network of local coalitions that are critical to how we got to have a Master Plan for Aging in the first place and how we're going to make sure it is a plan for action and not sit on the shelf. So they were very happy to hear that you all are the beta testers, you are the co-creators, the inventors who are going to bring this to life, and that we have a second one coming up with this is very important for you all to know, a webinar with County Board of Supervisors. That's our next one, to bring the local playbook to them, because we very much know that this requires a partnership between public-private, between nonprofits, service providers, consumers, local government, the business sector. And so we're really happy to be working with both, with all parts of that. So what I just want to say to you is two things. Despite the fact that it is currently hailing outside my window, I have spring on the mind, and I hope you do too. Spring is just around the corner. There are daffodils in my neighborhood. They were about to, I think, get an hour back, I hope, in time, because, and I really do feel like the Master Plan for Aging is one of those signs of spring after this very cold winter of COVID that coming out of this with new life, new growth, new hope is so important for all of our mental health, so important for all of our work, so important for all the people we serve, for our families, for our loved ones, and that the Master Plan for Aging work that you are doing and will continue to do. Hi, everyone. It's great to see people pop up. We're all one big family here. Literally the popping up like a crocus in the ground. Hi, Sarah. Hi, Gretchen. Spring is springing in popping up in all these hopeful, beautiful signs all over the state, and that is you. But the other sense of the word spring on my mind is what we hope the local playbook is for you, which is a springboard. I don't know, depending on what generation you grew up, you may be calling on a different gymnast in your head. I'll do Simone Biles. If you can picture her running down the mat and then hitting that spring and then vaulting in the air in a wonderful, amazing high leap and then sticking the landing, that's who all of you are. And we want the master plan to be your springboard. You are the experts. You have been training. You know all there is to know about aging and disability and planning. We just want to give you a boost and help you take it to the next level, help you add some new twists and turns, and most of all, stick that landing so that we have master plans for aging all over the state. So with that, I'm so excited by your lineup. Amanda Lawrence, our project director, who really is the brains and the heart behind the local playbook, as well as our great team, Carrie Graham and Terry Shaw, and all of you who welcomed me on this journey when I began at CDA almost 2 years ago, and now are really gonna spring us forward. So with that, thank you so much, Callie, and have a great afternoon.
Thank you so much, Kim. And Amanda, we're so excited to have you. Everyone, this is Amanda Lawrence. She is the project director for the Master Plan for Aging within the California Department of Aging. And she is going to help us start this deep dive onto a springboard. Love all the visuals and learn more about this local playbook. So Amanda, thank you so much.
Hi everybody. New names for me and a few new faces. I did enjoy seeing a couple pop up there. I'm so excited to be here with everybody, not just to present to you on the Master Plan for Aging playbook, but to have an opportunity to learn from you so that the MPA can devise the best modes of support for those of you on the ground implementing age, dementia, and disability-friendly programs, policies, and plans. Like Kim said, you guys are the experts. I want to thank you for completing that pre-survey that went out in advance of the event. I really appreciated being able to hear some of your perspectives and your challenges and successes that you've had over the last year with your coalition. And I'm super happy, of course, to be joined by Terry Shaw, our data extraordinaire consultant to the MPA, and then Rafi Nazarians from AARP. Those two will go further into two of the key plays of the playbook after my presentation. And then, of course, looking forward to hearing from the panelists facilitated by our devoted and invaluable MPA consultant, Carrie Graham. So the Master Plan for Aging, the long-awaited plan. It launched back in January, and we launched it with 2 public events. Videos of those events are available on our YouTube page. If you want to check those out, it's a great opportunity to hear from state officials and legislators what they're excited about the Master Plan for Aging, what their hopes are for the plan and that vision behind the plan. And then, as you know, the Master Plan for Aging is available on our website. It shares those 5 big bold goals that we've set for 2030. It also includes the 23 strategies that we developed to drive the progress of those goals forward. And it also outlines 132 initiatives that the administration has committed to over the first 2 years of this 10-year plan. So why did we make a local playbook for the Master Plan for Aging? It's because we recognize that a vision as bold and grandiose as building a state for people of all ages, that the state cannot go it alone. It's what happens on the ground at that local level where so many Californians, young and old, experience the benefits, or hopefully will experience the benefits of this Master Plan for Aging and all of the associated local planning efforts. And given that it's not just a plan for state officials, the MPA calls for state and local government to work with philanthropic organizations, community-based organizations, health plans, tech companies, and other private industry to advance this vision. And we also know that we're not the expert in all things. And so we need state and local partnerships built on a robust dialogue with your input, suggestions, and nudges from locals to really move the MPA forward so that truly is a plan for all Californians, regardless of race, income, gender identity, sexual identity, ability, age, and including, of course, location. And ideally, of course, the administration, we would love to see a master plan for aging at every county. And with the master plan for aging, with the AAA's plans and AARP's age-friendly network models, there's plenty of existing work and great frameworks for everyone to build upon. And of course, I know that not everyone is working on an entire breadth of an age-friendly plan for their city or county or region. So this playbook also offers resources to address specific issues related to each of our 5 goals and 23 strategies. One coalition did mention in the survey that during their assessment work during the pandemic had revealed a lot of those long-standing issues that we knew existed, of course, related to isolation, digital divide, access to nutritious food. So the state is right there with you, first and foremost. We know we had to get through this pandemic safely, and we know that we have competing priorities, and we will continue to push that work forward of the master plan while distributing vaccines and trying to advance equity. And we're really hoping that given these lessons learned during COVID-19 and the lessons that we continue to learn, that coming out of this pandemic, we'll have, our work will be stronger than it would have been originally. So that playbook, most of you have looked at it. I think 85% of the respondents said they'd already checked out the playbook. It's on our Master Plan for Aging webpage. I do want to point out that you can explore the playbook on the website, but we do have that downloadable PDF. The PDF also includes all the resources hyperlinked to take you directly to the resources we've highlighted. I do want to point out, though, that the PDF version is an abbreviated list of resources. So for the comprehensive list, you'll need to rely on the web page. So when building out this master plan for aging and the local playbook, it was kind of a challenge because how can we make a blueprint that really suits everyone? Not all regions are alike. Everyone here knows that. We experience different challenges and have different priorities. And then there's those complexities within each region as well. For example, I totally recognize the dearth of rural models for age-friendly planning resources. Canada has actually been a bit more forward-thinking on applying the age-friendly lens to their rural planning, and we're in the process of adding those resources to the playbook. And then also, if you have resources that you'd like to share, you can enter them into the chat at any time today. Or just email me, always open to hearing about new resources, existing resources, and new models to highlight. And so what we've created with this playbook is a guide or a set of steps or plays that apply to project, policy, program planning. And we've vetted these resources so that they suit a whole suite of needs, populations, focus areas in alignment with the master plan for aging that we hope can help any local agency plot out a strategy to improve the age and disability friendliness of their region from the beginning organizing phases all the way through those implementation and evaluation stages. Of course, AARP is a recognized leader in this space, and you'll see that in the playbook, it's rife with AARP resources, including planning and evaluation guides. So some of the results from our Convening's pre-survey indicated that many coalitions have had their greatest successes in that play 1, developing partnerships and working towards a shared vision and engaging local leaders and educating stakeholders. And then some of the greatest challenges expressed, not surprisingly, were juggling competing priorities and, of course, COVID-19 response activities. So, and as I mentioned before, lack of local rural resources and models. Over the course of the presentation, I'll touch on each play and highlight some California successes. And as Kim said, spring is here. That means allergy season is here. So bear with me as I take several sips of water throughout this presentation. So we have here, play 1, engage your local leaders. Of course, collaborative and cross-sector partnerships are key to implementing successful projects, policies, plans, and initiatives. 88% of the respondents to our pre-survey said they had already engaged with local leaders. San Mateo said they had a lot of success with the Board of Supervisors and their support for age-friendly funds to hire consultants. 6 cities have completed and submitted and been approved by AARP to be designated age-friendly. Contra Costa also working with the Board of Supervisors, City Commissioners on Aging, service providers, and AAAs and other stakeholders. Getting them all to the table was a huge success. Yolo County has engaged all 4 city councils and managers and aging commissioners on the concept of age-friendly communities. Others have indicated their ability to raise awareness of age-friendly issues in their community to local and elected officials, which has been integral to advancing projects. We know that siloed agencies can be a major barrier to advancing this age-friendly work. So bringing together city and county officials and getting various sectors to see how aging should be a consideration in everyone's work is a huge achievement. At the state, we did the same thing. We engaged every secretary, or each secretary from each agency across the governor's cabinet to really make sure that aging is viewed as a piece of everyone's work. It really does touch everyone's work. So we were able to collaboratively get specific actions committed to from each agency within that cabinet. And it's this cross-sector sort of planning ensures that something such as like transportation isn't planned completely separately from, other planning aspects like housing and land use. So how else would we create a transportation system that ensures that key destinations are actually reachable via multiple modes of transportation? And here is the Play One page on our website. You can see that we have a series of drop-down menus that highlight local entities from across sectors that have a local presence. And I also do want to call out the value of the research and academic institutions that we have in California. We're really blessed. There are just so many professors, researchers, and students that we could tap for support. This slide certainly lacking in all the researchers and institutes that are out there. Community colleges and colleges like Sac State have gerontology programs. So they actually are an asset and have many professors and students willing, ready, and able to assist with age-friendly projects. So Play 2, explore local data. Meaningful metrics are the foundation of project planning and evaluation. And there are several publicly available and user-friendly data sets that can be used to help determine the focus of your project. Now, we will dive later on into the dashboard for aging with Terry if you've chosen that breakout group. But I'll just do a little brief overview of that dashboard for aging and other data sources. And I did see that 45% of coalitions indicated that they have been able to use data to support their activities, with 15% have indicated they haven't been able to find the data that they need. And one challenge is also a challenge that we experienced is there's a lot of different ways data is being captured. Some cuts off 65 up, some 60 and up. So in the dashboard for aging, we've done our best to always stick with that 60 and over data slicing. And then this ties into goal or Play 1 of engaging your local leaders and is public health. Of course, public health departments are an asset when it comes to getting the data that you need. So if you go to visit our data dashboard for aging, you can see that we offer a way of monitoring the progress of the master plan over the 10 years that we have selected to create those goals for. And you can also explore data on a local level. We've created the dashboard in a way that it aligns with each of our 5 goal areas. So each goal area does have select indicators that we will be monitoring over time. We also have a dashboard, a progress dashboard, where you can see the trends over time. And we also offer a lot of data indicators and demographic data available at the local level. You can actually print out a demographic snapshot of your county if you scroll down on the first page of the Master Plan for Aging Data Dashboard on Aging. And then there are certain indicators that are broken down by local level, and Terry will cover those in her breakout session. And if the dashboard's a little bit overwhelming, great news. We created 4 videos to help acquaint our users with the dashboard. And we also will continue to do user testing over time. The dashboard is going to develop over time. It's version 1.0 right now. We're always adding, enhancing our data, and continuously will update the data as new sets become available. Also a great resource for local data is AARP's Livability Index. You can go ahead and search by your zip code there. Moving on to play 3, review existing local age-friendly models. And a lot of respondents said you had gone ahead and worked through this play in the playbook as well. So we have, we know that we just have so many models to look at. We've got models in the US, we've got models in California, we've got models in other countries. So before developing your own plan, just a great idea to see what's out there, what resonates with you, what you think is replicable in your own community. And if you go on our website, this is that Play 3 page. You can see that we have drop-down menus available for 4 different types of planning. We are soon going to add rural age-friendly models to this section as well. And of course, AARP is an absolutely fantastic resource when it comes to their age-friendly models. You can read about the stories of age-friendly network members on their website. So play 4 is select your MPA initiative for implementation. And all of that engagement that we had over the past year plus has resulted in those 5 bold goals and 23 strategies. So I'll just briefly touch on how we've broken down the playbook by each goal area and show you how best to explore the playbook. So our goal 1 is housing for all ages and stages. We've hosted several webinar Wednesdays during the MPA development process. And a lot of those actually have content that fits into goal area 1. So if you haven't listened to the webinar Wednesdays, you can find those on our website. We had San Diego share the work they've done with parks and recreation programs related to increasing accessibility and also their focus on intergenerational activities, which is a twofer because that's goal 3 and goal 1. We also had Santa Cruz, San Benito, and Contra Costa County talk about transportation projects. We had several leaders talk about housing. Sonoma County and Anna Acton, they presented on emergency preparedness, all different strategies within this goal area. Now, the Senior Coalition of Stanislaus County, they shared a success in their survey that transportation is their strongest success, that since January 15th, there's one coordinated system of transportation for all cities, except for Turlock, who chose to maintain their own. And they worked with Unite Us to use a shared technology platform that allowed everyone to work together in real time to support complex needs of local individuals and families. So let's say you're in the master plan, the local playbook, and you want to look at, you maybe want to do a project on transportation beyond cars. So you could go ahead and click the Transportation Beyond Cars plus button, and it'll drop down to show you all of the resources we've selected that we feel like are strong models for improving transportation, not just beyond cars, but also transportation safety, because we know not everyone's going to give up their car. Let's see. And we know that we need those multimodal solutions. Let's see, we had Nevada County also had they have a transportation project where they created the golden ticket. So everyone 80 and over gets a free pass on that transit. Los Angeles County has a comprehensive transportation plan. The Village Movement offers volunteer matching for rides, and Cycling Without Age is a national organization that has 9 chapters across California. And Debbie Toth was also one of our presenters, as was John Cunningham, who is here today. Goal 2 is Health Reimagined. And so you can see that we have several strategies in that goal area: geriatric medicine, dementia related to lifelong health. We put a focus on aging over the life course in this master plan. It's a plan for people of all ages. And of course, bridging healthcare and home and community services. Couple models that we highlighted in our master plan are Partners in Care Foundation, who provide workshops and other chronic disease management and prevention activities through payer systems. And then Inland Empire Health Plan has some fantastic long-term supports and services strategies, such as multidisciplinary teams of social workers, nurses, and care coordinators. So then goal 3 within play 4 is inclusion, equity, not isolation. And so we want to make sure that people can meaningfully and actively engage socially throughout their entire life course, whether that's purely for social reasons, or maybe they want a job, or maybe they need to work. So we want to ensure that people can engage it any way they want to. We've had lots of work done on closing the digital divide. We're doing lots of equity and inclusion work. I forgot to include in this presentation that CDA is offering monthly Ensuring Equity in Aging webinars. Those are a great resource because those are literally peer-led. We have local, state, and some national speakers talk about their experiences providing or designing policies, programs, and activities that ensure equity as we age. We're really trying to address that intersection of race, ethnicity, gender, sexual identity with aging. And we focus here, our local model was Purposeful Aging Los Angeles. They've created several venues for older adult engagement and intergenerational engagement. Also Santa Cruz Adult Services, they were a local presenter for one of our webinar Wednesdays. They have put together some fantastic ways of engaging older adults with arts and exhibits. Self-Help for the Elderly was a great resource for designing opportunities for limited English proficiency and immigrant communities to find work opportunities. And then in San Diego, they also have activities for grandparents who are raising their children. They offer camping opportunities called Gramping. So we've got the AAAs working on bridging the digital divide via partnership with private tech companies, distributing devices to older adults. We just want to make sure that older adults have a way to keep in contact with their friends, their family, but also the networks that provide them services and supports. So goal 4 is caregiving that works. And we have 3 strategies within there: family and friend caregiving, providing resources for those folks, direct care jobs, and virtual care expansion. Our local model that we highlighted in our playbook is Health Career Pathways. They help people graduate with a certification that they need to become a caregiver in their community, and they provide high quality classroom and clinical training, equipping students with technical and critical soft skills that they need to succeed as working professionals. And they're also working with education and legislative partners to allow other communities to launch similar initiatives. And this is out of Contra Costa County. Nicole Howell, the ombudsman, is leading this. And then goal 5 is affording aging. And we have selected here as our local model. Let's go through here. Well, actually, let me tell you, this is what you see when you see the website Play 5. Oh, I'm sorry, I am advancing. Goal 5, okay. Great Plates Delivered program was our local model for this, as well as Project Home Key administered in San Francisco. And then we did have Janie Castillo from St. Mary's in Oakland speak on our webinar Wednesdays. She focused on hunger, homelessness, and poverty in Oakland. And then on our surveys, Senior Council of Alameda County indicated that they had advanced multiple initiatives and policy changes, including bringing an age lens and age-friendly solutions to the county's homeless and housing insecurity response efforts. They were implementing protections for older low-income homeowners, as well as mounting a crisis response effort to address food insecurity. So that sums up Play 4, the most complicated play. It walks you through every single goal, every strategy, and has just probably over 100 resources for you to check out. Play 5 is Build Your Action Plan. And Rafi will go ahead and facilitate a breakout session on this in a few minutes. We really want to ensure that when you are creating your action plan, that you bake equity into it from the beginning. So when you go on the website, you'll see that we have 2 drop-down options: the age-friendly community planning resources, and then the equity baked into your planning. Once you've determined your project's focus, you'll be able to develop goals, objectives, strategies, and evaluation measures. We've included in our community planning resources several that came from AARP, as well as the World Health Organization, Grantmakers in Aging, and several other organizations. And place 6 is evaluating your age-friendly program. We have 3 resources there to help you evaluate that project that you are going to be working so hard on. And of course, AARP is in there again. And then place 7 is staying connected. We really want to ensure that we celebrate our successes, but we also learn from our challenges experienced and communicate, like in this forum, keeps things like this up. The state wants to hear from you. I want everyone to hear from each other. So I'd really like to, moving forward, think about ways that the state can support, or we can work collaboratively to create those local master plans and have them feed directly, right up into that larger master plan for aging for the state of California. When you go on our website, place 7, you can see there's a little button that says share your story. We received our first submission just a couple days ago. So please, share your stories via this avenue. You can also email them to me. Love to hear about them. And this concludes my whirlwind tour of the Master Plan for Aging Playbook. I want to thank you, SCAN, for hosting this amazing event. And I look forward to joining one of these breakouts to hear from our speakers and from everyone attending today. I hope I get a chance to actually see people at some point and hopefully meet you in person one day. But you can always reach me at engage@aging.ca.gov for any questions, comments, or ideas. And I'll hand it back to you, Callie.
Wonderful. Thank you so much, Amanda. That was really a lovely deep dive. I took a ton of notes. I loved the language that you used, that the regional coalitions could help nudge their communities to the next step. And I would really encourage all of the regional coalitions to consider how you could include the local playbook, the copious amounts of resources. Where are you in those plays? What are you drawn to? What is your community need support in? And I think it would be really exciting to then share, that play 7, as you noted, Amanda, kind of share outcomes from your events. So this was incredibly helpful. We do have just a few moments, Maria. So I think that if there, Amanda, would you be open to taking 1 or 2 questions?
Sure.
So I'm looking in the chat. I did see a question about rural resources, and Amanda, you noted that. So I think that was a request. So if you have rural resources that you can provide, Amanda, it sounds like you're going to draw from Canada. I know our coalition in the North, Diversability Advocacy Network, I'm sure has some great ideas for you, as well as our other coalitions that represent rural areas. Let's see, Shirley Crone from the Contra Costa Coalition, I'm seeing on play 1 under local leaders. They wanted to know about adding the California Senior Legislature. So Amanda, if people have additional ideas to update the playbook, how should they communicate that to you?
You can go ahead and use that email address on the screen. And then if we are able to capture the chat today, that'd be great. And I can pull from the chat box.
We will definitely provide the chat, but you guys have that email address right there, and our regional coalitions are a wealth of information. So again, I would really encourage you, Amanda's very frank request for your information, your guidance, your thoughts. Please take advantage of it. We have a question about intertwining different communities like the LGBTQ community and senior services, those who have HIV. Amanda, do you have any responses to those questions?
We do have, I know Ventura County, I believe, created an LGBTQ friendly aging project. I would look into those. And then Open House in San Francisco, they have coordinated so many activities that span LGBTQ and other communities regarding housing, but also, I mean, housing's their focus, but really they offer a lot of different services, and they'd be just a great organization to reach out to for ideas and models.
Wonderful. All right. Thank you so much, Amanda. We really appreciate your time. I am very excited for the magic of Zoom to break us apart into these two deep dives. Thank you, Terry. Thank you, Rafi. Maria, I'm going to turn it over to you to make that magic transition occur. And afterwards, we'll have a brief report out. Sarah and Terry will be taking over one session, and Rafi, I'm going to support you as well so that we can report out to the entire group.
But why don't we just go ahead and transition? I see Terry here. I'm pretty sure Rafi is here as well. And our next part of the agenda will really be to kind of hear a report out from these breakout sessions. So don't worry if you didn't get a chance to attend both of them. We will kind of learn a little bit about what was discussed. And so I will pass it off to Terry to give us an overview of the themes and kind of what emerged out of the local data conversation.
Sure, I'm happy to. And also, Sarah, feel free to jump in with any thoughts that you have. I think we had a great conversation. People asked some really good questions about their ability to reuse the data that's in there, which absolutely we encourage that. And also some detailed questions about, for example, transportation data and digital divide data, all of which, you know, we noted that the dashboard is a work in progress, that we are constantly looking to improve it. And there are some areas where we definitely have current plans to build out more data. We also do have some areas where there are real limitations in the real world on the data that exists, and therefore our ability to reflect it in the dashboard. And so part of the utility of the dashboard is not only to gain visibility into the data that is available, but also to see where there are gaps that we can all be working to fill over time. So those are my quick reflections. Sarah, anything you want to?
Yeah, no, I just want to say thank you so much for a wonderful overview, Terry, and just kind of helping everybody see how they can use the data for their own purposes at the local level. But something that really strikes me about the importance of data is that you really can use this data to tell a story. And yes, it's a work in progress, and yes, it will be iterative, and you'll continue to refine and build on it, but it can be such a helpful tool at the local level to help educate you know, your local advocates and policymakers about what the need is, you know, outlining what the solution is to address that need, and then of course showing the progress to meet that need. So it's just a great tool for educating, for engaging, for advocating, and for measuring progress. So understand that we still have, you know, much more to do in this area, but boy, are we much further along than we were a few years ago. So thank you for all the hard work that's gone into that. I would love, I don't know, Callie, there's probably not time to hear from any others in the group, but
we actually do have some time. I think if anybody wants to reflect on what Terry reported on and Sarah reported on, you can either put it in the chat, I'll try to capture it, or you can put your hand up, or we all know each other. You're welcome to just unmute and go for it. And let's see if we have any questions for Terry or Sarah.
Callie, this is CJ. I'll unmute quickly. You know, we've had some struggles up this way about the resources within the database covering these far northern regions, and we're just kind of in a quandary up this way. It's excellent information. We're just finding what applies in some of these larger metropolitan service areas. The data is not necessarily applicable up here. So I guess my greater question would be, what can we do at our coalition level, at our network level, to encourage more participants within this structure to get more data in these more rural regions like the North State.
Terry, Sarah, any reflections on that?
Terry, I think you're probably good for taking this one.
Sure.
That's good. Pass the buck, right,
Of
Terry?
course. I'll take it. No, I mean, so in my mind, there are two challenges to this question. One is having the data, getting the data, and, having that at your disposal. And that's a big challenge because of resource constraints and service limitations, et cetera. The piece that's reflected in the data dashboard, though, is more about the limitations in being able to show that data once collected. So we can't show it if it isn't collected. That's one. But two, sometimes, especially in the rural areas, it's very difficult to show the data at any level of specificity because the numbers are so small. You risk exposing people's information, which none of us wants to do. So we have to find appropriate balances between, those not balances, but we have to be mindful of both of those sets of challenges. And so in some cases, there's a limitation in the data that's shown, not because the data doesn't exist, but because it's so small that it's too sensitive to show. So it's an unfortunate reality of rural, and that's why in many places in the dashboard you'll see aggregated regions, because then we have enough power of numbers together to be able to show some of those divisions. So it's a real challenge.
Yeah, and we have a tendency here where data is drawn into, for example, the Sacramento region, but to compare Sacramento, for example, to Corning or to Oroville, which is our county seat here in Butte County, it's like apples and oranges. So our challenge then in reaching out in the community is we get that feedback, well, this doesn't really apply here. So we're kind of struggling here to get people to even participate. And I hadn't thought about this aspect that you brought out, is that with small amounts of data, it can now become sensitive to even share it. I can totally respect that. It's just a quandary that we're attempting to work through so that we can help with the expansion of this information overall.
Yep. Well, you can always get more people to move to rural areas. How about that?
Yes, one
I
solution.
like that.
Thank you so much, CJ. And Terry, know that many of our regional coalitions have touched to rural communities, and this sounds like an interesting dialogue that we could continue to explore, where they could share their perspectives and again, maybe move this discussion forward. So I've taken note of that, and we're happy to circle back. With that, Rafi, do you want to report out on kind of your presentation? And I'm happy to share some reflections, and then we can open it up from our breakout if anybody has any other thoughts.
Sure. So much, Kelly. So we talked about the age-friendly network and all of the steps that entails, but we spent most of our time action planning and what action planning is and how it's from folks from different communities of different sizes, wondering how it would work for them. So provided a link to some resources that people can look at. Really talked about the fact that there are 54 communities in California that have already done this. Their action plans are available online. Maybe joining the network on its own, which is it's a different process. But really talked about also the fact that there's 8 domains of livability, but how others are adding, the domain of dementia-friendly or disability-friendly or emergency, and just is really important to each community. Just talking about how it's not a one-size-fits-all framework, but had some good questions. So I think those are the main points, Callie, and I'd love to hear what your takeaways.
Yeah, I really appreciated the presentation, Rafi. And I know you were having some connectivity challenges, but you put all the resources to your contact information online. So I would just say blanket, invite that if you want to learn more about the age-friendly program process. If you can't get in touch with Rafi, we're happy to connect you. I think what I took away from it, and I want to draw from an example of a regional coalition, Rafi, is our partners down in Orange County, the Aging Services Collaborative of Orange County, they have an ongoing survey that they've done for many years now and in multiple languages that they deployed in their senior centers and events that really just asked some simple questions about what would you need to kind of age in place, remain living in Orange County as you got older. Like, what would you need to be able to make that happen? And I connected that to your presentation about the kind of 8 domains, the community life, and again, as you said, how to remain in your homes as you age. And I think that's the kind of connecting to the other presentation. There's some data out there that the coalitions have access to people in the community about what really matters, what people need at that at the grassroots level, and then being able to build on that to decide, what would be the best path forward under age friendly. The overarching question that came from our participants was how to sell this when you're asking for a pledge from a local leader, and also where to start. If you haven't engaged, or as someone noted that their county seemed to be at the bottom of a list somewhere, just how you would start. And so I'd love if Rafi, if you could just take a moment, if you had that elevator speech, you got a minute to tell somebody, where do you start and how do you really sell the program? I think everyone would benefit from that.
Yeah, I think, you put a coalition together, you put a group together that really wants to work on this, and you make that clear to your elected officials that this is something that, there are residents in your community that are committed to this. They're the ones that want to help move it forward. And I think, leaders, elected officials really respond to that when they hear from residents and voters in their cities and counties that this is something that's really important to them, and they listen. And when there's people that are willing to step up and help with the work and lead, I think it makes it easier on elected officials and leaders as well. And as I said, there's different examples of this. There's several of our communities where it's completely run by residents or coalitions or nonprofits, and there's others where the cities and counties themselves do it. It's a combination, but I would put that together and let them know the commitment of the residents in their community. Information on our roadmap to livability series, where you can look at all that and get some ideas from others as to how they've done it as well.
Wonderful. Thank you so much, Rafi. I see there's a question that's been asked. It's really about storytelling and inclusivity. And I'm wondering, either Terry or Rafi, Sarah, or anyone else on the line that would like to share, how do we elevate the diverse stories of people who are aging? As you'll see in the chat, one of the questions is that we all do end up together. And so how do we learn about each other and seek acceptance together? Any thoughts from either the age-friendly community work or the data work? Terry or Rafi, I'll start with you, about that kind of inclusivity and learning from each other as we age together.
Yeah, I'll just briefly touch on the network. As I said, it's very flexible, and how you set it up. One of the main parts is respect and social inclusion. So different communities, depending on their residents, focus on different parts of their of their constituency. Ones that comes to mind right now is in the city of Los Angeles, when they did listening sessions. They with youth, they did some with the LGBT community. They reached out to the unhoused community. So really sort of cast a very inclusive net in order to get the best information possible, so that they can make Los Angeles a great place for people of all ages in an inclusive way.
Thank you, Rafi. Terry, you're still unmuted. Do you have anything to add?
I do think that data is a great way of telling stories, but not necessarily those personal stories. So, which I think is more of the point of the discussion. I do know there are some story collection efforts that are brewing, and hopefully we'll be able to talk more about those soon. But there's lots of great archival efforts to really capture people's stories in very, very human ways that I think can be extremely powerful.
Thank you so much for that. Thank you, Terry. Thank you, Rafi. Sarah, thank you everybody who participated. And I see Carrie Graham on screen. She is the facilitator for our closing panel. So we welcome Carrie, and we thank you everybody for sticking around with us and looking forward to this panel's discussion.
Great. Should I take it away?
Go for it.
All right. So thanks so much for having me today. We are going to spend the next 30 minutes talking about some really important topics in the intersection of local and state policy. I'll just quickly introduce myself. My name is Carrie Graham, and I have had the honor to be a consultant for Kim and Amanda on the Master Plan for Aging over the last year. I've recently changed jobs, and I'm now Director of Long-Term Services and Supports at the Center for Healthcare Strategies, but I will still be continuing on, I'm happy to report, with a little bit of my time supporting some of the implementation efforts. So I'll be moderating this session on issues that I think this is a great session because it's, there's so many things in the Master Plan for Aging. I mean, 130 different initiatives, things that can seem sort of pie in the sky when you're talking about transforming the landscape at the local level. And today we're going to be hearing from 3 experts that are going to be talking about issues that I think are just so some of the first things that come to mind when people are working at the local level. One of those is housing. Another is transportation, and then also the importance of building bridges between aging and disability communities. So we have 3 great panelists who are going to be talking about these different topics. And what is everybody on? Anna, are you there? Anna, John? So first we have Anna Acton, who's the Executive Director of the Freed Center for Independent Living. She is an expert in many things, and I'm going to let her introduce herself, but she's going to be talking today about the intersection between the aging and disability communities, which was something that was such an important part of the Master Plan for Aging, because it's not the Master Plan for old people, it's a Master Plan for all Californians who are aging. Then we have John Cunningham, who is the Principal Transportation Planner for Contra Costa County. And I know he's going to have a lot to add to the conversation about transportation, that there's a lot of room for improvement there. And then Sharon Rapport, Director of State Policy for the Corporation for Supportive Housing. So what I'd like to do first is just have each of you just quickly at the outset spend a minute introducing yourself, and if like Anna had an important role on the master plan development, so talk about that a little bit, and then we'll get into the meat of the conversation. And we will have about 10 minutes at the end of this session for all of your questions and for your input, for question and answer from the audience. So Anna, are you there? Are you unmuted? Hi. Can you introduce yourself?
Hi, Carrie. Thank you so much. I don't know if I'm an expert in all of this, let me just say, because we are all learning as we go. And I've learned so much from all of you. My name is Anna Acton. I'm the Executive Director of Freed. We're an independent living center. We are a non-residential facility. I'm sure most of you probably know what independent living centers are, but we provide a whole variety of services to people regardless of type of disability, regardless of what the age of the individual is. We serve 5 rural counties, so Nevada, Sierra, Yuba, Sutter, and Colusa County. We also are a core partner in the Aging and Disability Resource Connection of Nevada County. We're one of 6 state designated ADRCs in the state. and probably, I think, really the only rural state designated one at this point. And then we're also working on developing an ADRC in Yuba and Sutter counties. So I was really honored to work with so many amazing change agents, I will say, throughout the state around aging and disability with the Master Plan on Aging. And I was on the Long-Term Services and Support Subcommittee. I do have to give a quick shout out to Jan Arbuckle, who's on here, who is our city vice mayor right now for one of our cities, and was also on the Master Plan Stakeholder Advisory Committee. And so my role there was twofold, threefold, however many fold, really bringing a rural voice around aging issues to those efforts, but also bringing a disability perspective. And that ended up really being, I think, important as we look at aging. We're all aging. We were able to go into some good detail around just general stigma around aging and disability, ableism and ageism, and how that plays out in our policy work, local level, statewide, and really trying to bring to the table, looking at the functional needs of our community, regardless of age, regardless of disability. Many of the things across the lifespan and ability level can be looked at as a whole community, as a whole person, to really help drive policy change around kind of the functional needs and supports that people need to remain living in the community. Thank you, Carrie.
Great, thanks for that introduction. Now we're gonna have John just quickly introduce himself for about 1 minute. John Cunningham is Principal Transportation Planner.
Yeah, hi, thank you, Carrie. Yes, that's my current role in Contra Costa County, and as a Principal Transportation Planner, it's really a jack of all trades type of planner. I work on roads, bike ped facilities, pedestrian facilities, transportation related legislation, and one big part of my work is accessible transit, which is why I'm here. I've also been a planner at sort of the next level in the transportation hierarchy, which is metropolitan planning organization outside of California. But really, I think probably the reason I'm here is I began my career working for a countywide ADA paratransit brokerage in Santa Clara County. And when I left for Contra Costa County, I was the operations manager, and that sort of gave me some good background to work in this area. And then finally, by way of introduction, I was fortunate to be able to provide some support to the Stakeholder Advisory Committee during that Master Plan on Aging process. Thanks for having me.
Great. Sharon, would you like to introduce yourself?
Sure. Hi, everybody. I'm Sharon Report. I am with the Corporation for Supportive Housing. Just to introduce what we do, we're a national nonprofit. We have 3 offices across California. We do a lot of work. We don't actually provide housing or services, but we do a lot of work to foster the creation of housing solutions to homelessness. We are a community development financial institution, so we do loans and grants to communities and nonprofit organizations to build housing and provide the right services mix for the population being served. In my role, I work on policy at the state level, so I do a lot of thinking about next year's solutions to homelessness today. I am a registered lobbyist, so I do a lot of work in the Capitol to promote legislation to generate more state dollars to build more housing, to create more opportunities for people to get into housing, and to provide the right kind of services mix for people experiencing homelessness.
Wonderful.
And if I could, I'm sorry, Carrie,
yeah.
quickly put in a plug for just to let everybody know that we recently received a grant from May and Stanley Smith Foundation, and we're going to be doing a lot of work around determining what the right policies should be in the state for older adults experiencing homelessness. So I just wanted to let people know that we're going to
Congratulations.
Thank you.
Congratulations.
So that's going to be a big project for us for the next 2 years.
Exciting. All right. Well, I want to first start with Anna. And so my question for you is, when it comes to state and local policy, what is What do you think are some of the most important aspects of the intersection between aging and disability? And why is it important to leverage advocates from the disability communities when you're planning your MPA initiatives?
I think there's so much crossover between the aging and disability initiatives. And because when we think about some of those supports and services, that people need, it crosses the lifespan. And, there are a lot of initiatives around aging in place. We hear that a lot with the Master Plan on Aging Initiative. And that really translates, when I think about it, around this work we've been doing for years around community-based living and ensuring that people, even with the most significant disabilities, are able to remain living in the community with the right services and supports. So I think traditionally, and for many years, we've sort of worked in silos, and both on a national, state, and local level around addressing these issues. And now in 2020 and 2021, right, we have an opportunity to kind of get rid of some of that siloed thinking around issues like transportation that John's going to talk about, like housing that Sharon can speak to, around in-home personal care, around the digital divide. All these issues that we're working on, really, we can help kind of lift each other up and I think create better outcomes for both the aging and disability community. I think it's really important when we're working with our local coalitions that we, and working on policy, that we are including both the aging and disability community. We get to know each other, have conversations, talk about what our values are and what we're about. And we'll find that really a lot of our missions and visions for the future really probably align more often than they don't. And so it really is an opportunity for us to work together. And I will just end by saying there are many local disability advocates that are really great people to have on your team to help with community organizing and with messaging and understanding the accessibility piece that many older adults will also need.
That's great. I also want to say, when I first met you, when we first started the LTSS subcommittee meetings, I remember you were a little distracted because you were dealing with some fallout in your county from fires or other natural disasters. So I just wanted to ask you to talk a little bit about planning in rural communities and what are some of the special considerations there?
Yeah, I mean, you bring up the wildfires, the disaster piece. What we see in every major disaster locally is that people with disabilities and older adults are disproportionately impacted. We saw that in the Camp Fire, right, with over 80% of those that died were over the age of 65. We saw that in Hurricane Katrina. A lot of this work really does come down to the local level response and ability to be resilient as a community. So there are a lot of rural considerations, I think, around any master plan on aging initiative. Carolyn, you mentioned a piece around, trying to create an initiative in a rural community, and they're like, that doesn't apply to us. And I think we have to remember that and make sure that whatever we're doing is flexible and locally tailored to the local community. You heard that from the AARP presentation. There's no one size that fits all, and we have to remember that. And rural communities are really, I think, attuned and sensitive to that as well. Don't bring your, big town thinking to our little rural community. We have this culture we want to maintain that's really important to us. And so engaging local community leaders, just community members, and our elected leaders and decision makers to decide what is going to work for our local communities is going to be really important.
Great, thank you, Anna. I want to turn to John now, and I know you have some thoughts on the aging disability intersection in transportation. I wonder if you could speak to that a bit in local transportation policy.
Yeah, thank you, Carrie. And I'm going to pile on to Anna's comments here in that the transportation services for those populations are very similar, if not, the Venn diagram's a circle, frankly. And that's critical in a couple of different ways. One, in terms of advocacy, if we can aggregate the two advocacy bodies, that's the pressure that we're going to need to have the state prioritize this type of transportation, which frankly, and I think we're going to walk through it in a little bit, is not a priority right now. And so this type of transportation has a number of different names. It's dial-a-ride, paratransit, demand response, but it's sort of micro transit. And I think to I guess add on a little bit to that, this type of transportation is similar both in urban areas as it is in rural areas. So, there's, I heard you talking earlier about the divide and the differences in needs and thoughts between rural, suburban, urban areas. This type of transportation is really suited towards serving all of those communities, those populations, and those communities. So it's convenient in that you have a turnkey solution that is ready to be brought to bear on older persons with disabilities, and regardless of the where they live, city, country, etc. So it's a problem that is waiting to be solved, and yeah, there's a significant overlap, if not complete overlap, on transportation needs for both those populations.
Great. And so could you just tell us, what are some of your thoughts on what state policy can do to improve transportation at the local level? And, how is that reflected in some of the MPA recommendations and initiatives?
Yeah, thank you. The short answer in two parts that I'll expand on in a second is that the state potentially has a significant role, and their help is going to be critical if we're going to see some improvement in this area. And again, I'll talk about some specifics, but I guess the second part of that answer is I'm concerned, and I mentioned this earlier, is that I'm not sure from what I've seen that it's a priority. And I guess I'll walk through my observations there in a minute. And I say the state can potentially help because in my current role, I see how effective the state can be in other areas of the transportation system. Funding capital projects and routine maintenance it's well honed and efficient. There's it's very well done. So I know their influence can be brought to bear, and they can also show leadership in systemic or culture change when pressured to do so. The most recent example is the inclusion of bicycle and pedestrian issues. It's been brought into the broader transportation fold, and they're getting more funding and improved policies. So I know the state is certainly there, and it should be a player. And when I say I'm concerned that this might not be a priority, I guess there's two examples. First is funding, and second is the master plan. So I'll get right down to it here in a second. And you might have heard me use this example before, but in 2017, we passed a new gas tax. It's $10 billion a year for all different transportation types of projects: roads, maintenance, bicycle, pedestrian, conventional transit, boating, agriculture, but no money for this type of transportation: accessible transit, transportation for older persons with disabilities, zero dedicated dollars. And so then getting to the master plan on aging, I just want to point to the outcomes. I understand that the effort was broadly successful. However, the transportation outcomes were a bit disappointing. And I think in at least one instance, I'm not sure I'll have time to get to it, it actually took us backwards. And so I looked at the language on the master plan transportation section, of course, and I understand how Caltrans and the transit industry typically review any policies coming out of the state related to transportation. And I recognize the language, frankly. And so I see where they left their fingerprint. The stakeholders proposed some very well thought out recommendations that were backed up by evidence. Again, there have been studies produced on this for decades on the limitations and failures of this type of transportation. So there was a lot of material for the stakeholders to bring to bear. It wasn't like we had to do any original research. It's there are plenty of studies on the books. And so specific examples from the master plan. There are a lot of recommendations on the transportation section, but I'm going to zero in on two key ones. One was funding again, and the stakeholders were very explicit. There needed to be new funding, and that sounds like on the surface of it a typical, every program and department needs additional funding every single budget cycle. That's not it. This section of the transportation system has had a severe budget drought for decades. There have been studies, recommendations, white papers describing how there's just a lack of funding. And so I don't want this to be an underwhelming recommendation like throwing money at a problem, but this area has been studied for decades. Again, we don't need more big thinking or studies or white papers. We just need the funding. And I'll talk exactly about what should be funded here in a second. And then, so, that was the recommendation of the stakeholders, and the outcome, the state response, and the final master plan was not only silence on funding, but a good number of initiatives explicitly say within existing resources. And I think we all know what that means. If budgeting is a moral exercise and sort of the ultimate reflection of priorities, the cards are on the table. And so the second thing that the stakeholders recommended, again, that were based on years of studies and recommendations, was expanding a mechanism of state law called, bear with me here, a Consolidated Transportation Services Agency. It's been on the books since the 80s. It's referred to as CTSAs. I won't go into detail here, but it's a mechanism to efficiently organize transportation for older persons and persons with disabilities. There's a variety of reasons there's resistance to this mechanism, but there are other paths to improvement. And I guess we might have recommended one of these other mechanisms. There's a federal requirement for localities to develop what's called, another big one here, bear with me, coordinated public transit human services transportation plans. And those are laying around waiting to be funded. It's an unfunded plan. Again, I guess there's a theme here. Anyway, so that systemic change recommendation from the stakeholders, there was no response in the final master plan. There was silence. That mechanism, the CTSA, was not mentioned at all. And so I guess at this point, it would be reasonable for somebody to say, well, slow down, hold on, we're just getting into implementation. Let's slow down and see what the state does. But if you take a look at the master plan local playbook, which talks about actions to implement, it's silent on transportation. I mean, the word transportation is in there in a few places, but there's nothing regarding taking action. It's a little odd on why the playbook is silent. And so I guess there are a few phrases that I've heard that are all sort of similar that describe what has happened here with these solid recommendations. And that is, you probably heard it before, culture prevails over policy, or culture eats strategy. And that's exactly what happened here. A very well thought out strategy and policy suggestions from the stakeholders ran headlong into the culture of Caltrans and the California State Transportation Agency. And so that's why I say I'm not sure that their priorities are with improving this service area. And so how can the state improve this? There needs to be culture change at Caltrans. Apparently we have to take a step back from the actual mechanisms. There needs to be a culture change, and it's not going to come from within. And the comments from Anna earlier about the combination of the silos, combining disabled and older persons, combining those two, I guess, advocacy powers might be able to force that culture change. And that's what's really going to be needed to have the state fund some of these unfunded mechanisms, some of these very well thought out unfunded mechanisms that are just sort of laying around waiting to be picked up and implemented. So yeah, those are my comments.
Yeah, thanks, John. And I see in the chat there's just so much agreement that this is an incredibly important area. So I want to turn to Sharon now. And Sharon, I just to talk about housing. So what do you think is an important role of the state in promoting local solutions to homelessness and marginal housing among older adults? Uh-oh, Sharon, you're on mute.
Sorry about that. Thank you, Carrie. So I thought maybe I'd just start off by giving like a little bit of background on what we know about older adults experiencing homelessness. About half of all people experiencing homelessness in California are over age 50. And that's important because people experiencing homelessness at age 50 have the same physical ailments and characteristics of somebody who's housed and 75. And so once people are on the streets, their bodies begin to deteriorate very quickly. We also know that in order to achieve the Master Plan on Aging goal of eliminating homelessness among older adults, we need to pay attention to three populations. Older adults living in deep poverty who are housed, but are experiencing cognitive, behavioral health, or physical challenges that will make it difficult for them to age in place. And then nursing home residents who could be living independently at home if they had a home to go to. And there are, according to some state estimates, about 11 to 12,000 people in that situation in California. And then older adults experiencing homelessness now with cognitive or behavioral health deficits. And this gets to Anna's, remarks about people with disabilities. There's also that link with that population. For that population, we do see a lot of people getting referred into licensed settings, like residential care facilities for the elderly, when they could be living independently if there were a model of housing, well-funded model of housing and support services that could help them live independently. So I just thought I'd give that a little bit of that background and then touch on some of the plays in the playbook and to give some recommendations to both local and state agencies. So on play one, connecting to local governments, we do strongly believe that local governments should be coming together with the homeless continuum of care. And just to give like a background of what that is, every community in California has a homeless continuum of care, or COC. And that's basically a body that's made up of local government and local stakeholders, nonprofit organizations working to end homelessness. And it is meant to be a coordinating body. They also access federal and state resources that they coordinate, and they have coordinating systems that refer people to housing and services who are experiencing homelessness. So just at the local level, connecting to the homeless COC for those agencies addressing aging populations would be really critical to kind of address the needs of those three populations I talked about. The state can play a role in connecting to agencies at the local level to play a greater role in collaborating with local agencies, but also do a better job of coordinating state agencies. So, for example, we do have state funding for housing right now to build housing. And the state can play a role in prioritizing some of those units that are built for older adults. They can also, the housing agency could be connecting with the state Medi-Cal agency to identify funding for services, for long-term services and supports for people who could be living in affordable housing if they had the right kind of services, and could be receiving personal care services in affordable and supportive housing that's independent. In play two, exploring local data, at the local level, we do recommend locals looking at connecting again with the homeless continuum of care that operates a homeless management information system. And that can allow aging agencies or agencies who are looking at aging populations to locate people experiencing homelessness who are older adults. The state can play a really big role in the data element, because the state is actually right now working on rolling out a homeless data integration system. And this would collect data from all over the state, from local governments, around people experiencing homelessness and put that data into a statewide system. And hopefully, we are hoping that in the future, that system can be integrated with other state agencies to collect data on, for example, Medi-Cal beneficiaries experiencing homelessness as older adults. We are hopeful that that will move forward. In the meantime, that statewide system could be used to assess, to do a big statewide needs and gaps analysis, what we call a needs and gaps analysis, which is basically looking at the statewide need. How many older adults are experiencing homelessness statewide? And where do we have gaps in funding and policy? And the state can do an assessment of that and determine, how to go about making up or filling those gaps. In Play 4, picking your MPA initiative, I think earlier today it was discussed about really promoting inclusion and equity through this play, and we really couldn't agree more. At the local level, in addition to the ideas in the playbook, locals can also consider using rental assistance available at the local level through Section 8 and other local rental assistance programs to help people move into affordable and supportive housing and housing with private market landlords in the community. And again, matching the services available to help people experiencing homelessness get the right services they need. The state can help people live independently by building and expanding funding for housing, including for rental assistance, which can get people housed very quickly, and connecting existing Medi-Cal programs that are intended to fund people to live independently through the right services mix in that housing. And then finally, in evaluating, we do believe that at the local level, local government should be evaluating and assessing for how many older adults are living independently in permanent housing now, and how many people are still experiencing homelessness. And the state should be doing the same and evaluating the outcomes from the Master Plan on Aging. So I'll stop there. I look forward to questions, but just thought I'd mention those recommendations.
Thanks so much, Sharon. Those are wonderful ideas. Really appreciate that. We have to stop at 3. And Callie is closing the comments. So I'm not sure we have time for questions, but maybe what we could say is that, what do you think, Callie? Should we have, make sure that people know how to get in touch with Sharon, Anna, and John so that they could ask questions after the session or through email?
Yeah, what we'll do is we've diligently been typing behind the scenes, given this robust dialogue. We're going to look into putting together a recording of the session today that we can share. And when we do share that with you, we will share John and Anna and Sharon, if you're willing to provide your contact information for continued discussion. And I just want to say, thank you to you, Carrie, to our panelists, John, Anna, Sharon, also to Kim and Amanda and Terry and Rafi. This has been a really dynamic presentation, and I hope that all of the coalitions have found some inspiration, maybe some new data points or lines of communication that you'd be able to integrate into your kind of local level events and discussions. A friendly reminder, I'd love to hear how you're planning to organize those events by the end of the month. So if you're a lead, please do let me know. And Maria, I'd like to give you the last word because the California Collaborative is going to take on a fun role to support all of our coalitions with these events. So with that, on behalf of the SCAN Foundation, thank you so very much. And Maria, why don't you close us out today?
Thanks, Callie, and thanks everybody for participating today. So the California Collaborative is actively developing an event toolkit to support all of these local master plan for aging events. And that will be available within a couple of weeks. What you should anticipate or expect to find in there is kind of an event planning checklist. There will be a sample agenda, which of course we encourage you to make your own, but you can play with it. We are developing a short social media toolkit to encourage you all to promote your events on Twitter and Facebook. And we will also be developing a short video, which will introduce the collaborative network, includes all of you folks at the regional level, kind of under that umbrella. And we'll give a short state of the state. So that could be part of your program. It could be something that you share out in advance to promote your event. So do stay tuned. Within a couple of weeks, we should have something to share with you. And we will be hosting an optional webinar if you'd like to tune in and just listen to the rollout and kind of an overview of what this toolkit has, how to use it. We will be offering that as well. And looking forward to connecting with you all as you plan your events.
Thank you so much, Maria. And thank you to all of you. Stay healthy. We look forward to seeing you soon. Enjoy your afternoon. Take care.